Good evening, everybody. Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and tonight we are going to talk more about diabetes management. The title of this video is Type 2 Diabetes, Initial Medication Management, Metformin. So we're going to talk about the use of metformin in the management of type 2 diabetes. I've chosen to separate metformin from the other treatments of type 2 diabetes. In the interest of time, I want to keep these videos short and to the point, so you don't have to watch a half-hour video to get a piece of information. And metformin is the most widely used medication for the treatment of type 2 diabetes, so we're going to talk about that. There are other videos where we're going to discuss the other things that we use to manage type 2 diabetes. So we talked about some lifestyle changes which are universal for anyone who has type 2 diabetes: their diet, their exercise. So now we're going to talk about when you get to that point where diet and exercise isn't enough and it's time to start medicating people for diabetes. How do you get started? So in almost all cases, and we're going to talk about when not to use metformin, but in most cases the first medication used for type 2 diabetes is metformin. So what is metformin and what does it do? Metformin is a pill, usually dosed twice a day, that helps glucose metabolism in three different ways. One, it slows down liver production of glucose. It slows down intestinal absorption of glucose, and it helps insulin work better. So those are the three things it does. A lot of people don't realize that we get glucose sugar from two different sources, from our food and from our liver. So our liver stores glycogen, which is a bunch of sugar molecules strung together. And when we don't have sugar, like let's say if you fast for 24 hours or something, you don't take in any sugar, your liver will break down glycogen and put sugar into the blood. Okay, so that's why if you go 24 hours with eating, it's not like your blood sugars drop to zero. They stay nice and stable because your liver is there. And so metformin helps slow that process down, slows the intestinal absorption, and it also helps the insulin work better to get sugar into the cells. So that's what it does. The studies on metformin are ubiquitous. It's a very old drug. We've been using it for years and years and years, and so we know that it works and that in most cases it's very safe. So how do you start metformin? The one thing that's very common with metformin is it can cause intestinal side effects. So it can cause bloating, upset stomach, and diarrhea. Now these side effects are they're less likely to happen if you titrate the metformin up rather than do full dose right away. So eventually, for most type 2 diabetics, you want to get them to where they're taking 1,000 milligrams of metformin in the morning and 1,000 at night. But you start with 500 and work from there. So usually what I tell my patients when they're starting metformin is I send enough medication in for them to take 1,000 in the morning and 1,000 at night in 500 milligram pills. And I say you go up every week. So for the first week, just 500 once a day. One pill once a day for a week. After a week, then do one in the morning, one at night. After another week, two in the morning, one at night. After another week, 2 in the morning, 2 at night. So after 1 month, they're on the full dose. If you just slap them 1,000 twice a day, some will do fine. A lot of people will have GI upset and they won't tolerate it, and then they'll say I can't take metformin, where they may have been able to take it had you titrated slowly. So start the metformin 500, work up to 1,000 twice a day for initial diabetic management. So when can't you use metformin? So there's a few things. Obviously, if there's an allergy to it, if the side effects aren't tolerable, so you will have people who come back after trying it and say, if I even take one pill, I just have diarrhea and upset stomach, I can't tolerate it. And so that's another person. And then the big one that you'll see on boards, and one you want to remember with metformin, is kidney function. Now, it's important to remember that metformin doesn't damage the kidneys. So it's not a renal toxic medication. But the kidneys are important to clear the metabolites of metformin. So if your kidneys aren't functioning that well, then the metabolites, the things that get broken down from metformin, build up, and then they cause a problem. Okay? And now when I went to medical school, the rule was a creatinine of 1.5. And so you check someone's creatinine. If it's 1.5 or above, no metformin. They've adjusted that a little bit. Now it's a GFR number, which is the glomerular filtration rate, the kidney function, more or less, less than 30. Okay, so if their kidney function is less than 30, then you cannot use metformin. If you put someone on metformin without good kidney function, then they could build up those metabolites and end up having lactic acidosis. I actually did see that once as a resident in the ICU. We had someone there in the ICU with lactic acidosis, and we discovered it was because they had kidney failure and were taking metformin. And so those are the times not to use it. They can't tolerate the side effects, and their kidney function won't allow it. There's some other things as far as heart failure and comorbidities that you want to pay attention to. I'm not going to go into those in this video. By and large, you have a new person, they're sitting in front of you, you've checked the A1C, it's above 6.5, they're doing the diet and exercise, they still have a high A1C. What do? You put them on metformin. Check a renal panel, make sure their GFR is above 30, put them on metformin, 500 ramping up to 1,000 twice a day. Let them sit on metformin for 3 months, come back, check them again, see where they're at, and then you can decide on further management, what to add if you need to. And there'll be more videos coming up as far as what stepwise approach to use when ramping up the treatment of type 2 diabetes, what goals to have, all that kind of stuff. But I just wanted this video just to be a brief understanding what metformin is, how it works, when to use it, and when not to use it. So I hope that's a helpful tips for you when dealing with metformin with your type 2 diabetic patients. And for now, I'll be signing off. This is Dr. Stokes with Bread and Butter Primary Care, and I hope you have a great night.